YWC as Secretary, we are ready to welcome each and every one of you.
Good morning, pretty ladies.
Good morning.
Praise the Lord. I welcome each one of you here, especially guest speaker, Dr. Shraddha Sarwar. Thank you for joining us, and I'm sure we are going to have a great time together, learning so much about mental awareness, which we all need to have. And thank you, President Ma'am, for making it here. I know how it was not so easy. Thank you so much. Welcome to our midst. Thanks to our CP of PASI, Rena Michiari. She's not here, but then she was involved right from the beginning. So thanks to her as well, and each member here, seated here, thank you for making it all the way from your homes and investing your time. I'm sure we're going to have a good time. And thanks to all my staff and all the efforts which they put in. And I'm sure it is going to be a great seminar together. Thank you so much. Over to you.
Thank you so much, Priyana. Now I call upon Party Committee member Vanita Landekar to lead us with devotion. Thank you so much, Vanita ma'am, for meaningful prayer. Now I call upon Party Committee member Ms. Alika D'Souza to introduce our today's guest speaker.
Thank you, Delphina. Good morning to one and all. This cool, pleasant environment. Aren't you feeling cool? Yeah. Hope you all had a lovely hot cup of tea too. Today we have gathered here to learn how to be aware about our mental health, which determines the way we think, feel and act. Let's get some inside secrets from someone who has vast knowledge and experience and who will guide us about awareness on our mental health. On behalf of the PASI committee, it is my privilege to introduce our distinguished guest speaker, Shraddha Sarwar. Shraddha is a young, versatile, dynamic individual, having diversified interests and is highly qualified in the field of psychology. She is a living inspiration with an impressive background. Shraddha, we are lucky to have you here with us spite of a busy schedule. Thank you so much. Shraddha is a Mumbai-based practicing psychologist with 25 years experience offering psychological solutions and strives to empower individuals and organizations to cope with various attitude, thinking, and behavioral related issues in Mind Matters, which is a psychological guidance unit founded and directed by Shraddha Sarvapesari. She is a NET, and SET certified lecturer of psychology, having more than 20 years of teaching and research experience. Shraddha is the founder and director of the School of Emotional Intelligence, which aims to train the masses on psychological skills and also create awareness regarding mind management. Shraddha is a creative writer to the core, associated with Society of Women Writers and Journalists. Her creative articles are very impressive. As creative writer and columnist in Mumbai Memoir series on a UK-based website in England, which is an online magazine. Shraddha, you are an inspiration to us. With your experience, research and expertise in the field of psychology, we are eagerly looking forward to a great session on awareness on mental health. Let's welcome our speaker, Shraddha Sarvapesari, with a round of applause. Thank you.
Good morning, everyone. Yeah. I was looking forward for this particular session. It's the month of May, which is considered to be the Mental Awareness Month. And thank you, YWC, for giving me this opportunity to promote. I call psychology as my second mom. Okay, I have two moms. One is my biological mom. Okay, who has raised me. Okay, at home. And the other one being psychology, who has helped me to be what I am today. And I would like to share all what I have absorbed in all these years and share it with you so that you and your well-being is established well. Okay? Shall we start? Yes. So let's start with the concept of fitness and sickness. Let's understand this concept first. These two words, fitness and sickness, particularly sickness, last 2 years we all have witnessed this concept very closely. But we need to understand the difference between fitness and sickness, okay? And when we think about these two words, what comes to our mind is physical fitness and physical sickness. Okay, but let's talk about physical fitness and sickness first, and then we come to mental fitness and mental sickness. Okay? The thing is, when it comes to fitness, on a regular basis, what is our culture? Okay, in what culture are we being raised, basically in terms of nutrition, in terms of exercise, and how is it influencing our body? So when we talk about physical fitness, we are talking about body-based fitness. And when things are not in rhythm, regularity and routine, always remember when it comes to fitness, 3 R's matter, 3 R's. Okay? Rhythm, regularity and routine. Okay? What are we doing on these lines, every day on a routine basis? What are we doing in terms of our diet, in terms of our exercises? Okay? That will decide the fitness aspect. And if we are not into a rhythm, routine and regularity about all the bodily things, sooner or later, sickness is going to come in life. That is the concept regarding the difference between fitness and sickness, okay? Also, fitness has a preventive approach. We have heard prevention is better than cure, right? So when we talk about prevention, we need to keep in mind fitness aspect. Because if sickness happens, cure it, right? So always when it is fitness, it's prevention. When it is sickness, it is cure part comes in, okay? Having said this, let's talk about gyms and hospitals, okay? When we think about gyms and when we think about hospitals, what comes in our mind is basically something, some treadmill or some sorts of, exercises and all of that. Again, there also when we visualize gyms, we visualize about physical health. Okay, when we talk about hospitals, we always visualize someone not ill at the physical level and that person is admitted and needs to be cured. Yeah, so if you notice the gyms, the physical gyms, physical health gyms take care of the fitness part, and the hospitals here take charge of the sickness part. So you see that, right? But again, the first two slides are focusing more on physical health. Now let's talk about, we have so many gyms around, right? But most of the gyms are focused on developing the fitness at the physical level. The next question is, where are the mind gyms? Okay, where are the mind gyms? Okay, I just want to ask, somewhere, all of us, either we or people who we know, they go to gyms, right? Gold gyms, Karnataka gyms, what not gyms are around. But are there chains of mind gyms? That is the unfortunate part that people are not aware or are not ready to understand this fact that the mind also requires rhythm, routine and regularity so that it stays fit enough and not lead to sickness. That's what we need to understand. What about the hospital parts of it? This we are talking about the gym part of mind. But talking about the status of mental health care facility. Okay, when I say mental health care facility, I'm actually speaking about mental hospitals here. But you know what is happening? The problem is there is a lot of neglect and denial related to mental health. And let me tell you, in terms of taboo, if you're going through depression, if you're going through some panic or anxiety, people do not want to talk about it. Or all is fine, things are fine, That is what they happen to say. But when this happens, when things are not fine, and something that is really bothering you, many people show it under the carpet. When I say show it under the carpet, what exactly I mean is, they show it in the subconscious mind. Okay? The conscious mind, right now, here and now, I tell you, all of you are focusing on what I'm saying and what I'm showing. So your eyes and ears are focused on what I am presenting out here. But your subconscious mind is functioning below. It's keeping a track of the sound that is coming from back. Okay? Everything around us. So everything that we experience, it actually goes into the subconscious basically. If it is well processed, then nothing like it. But if it is something negative, it will be shown on the carpet and it will stay there. And in unexpected manner, it might come up, like a ghost coming up and haunting you basically. So it's very important to understand that if something is bothering you at mental health levels, it needs to be addressed. It needs to be processed is what I'm trying to say. So many people are neglecting and denying that there's a problem. And these things happen. And that's what people say that. This is happening with me. This is how I dealt with it. And that actually, is definitely going to hurt the person that yes, it happened with you. But how am I going to deal with it? And that happened to you 10 years back. The dynamic has changed today. So it's important now to speak about value your mental health. Okay? so that you can apply it in your life and the ones who, the loved ones in your life, sort of, so that you know what, sickness will only come if we don't, if we allow it to come, right? So having said this, first let's understand the myths and levels of mental health checkpoints. Okay? When I say myths, okay, what am I trying to say here is, you know, people, when I showed the slide of the mental health care, right? I did not use the word mental hospital here. I used the word mental health healthcare aspects of it. Because what is happening, the word mental itself, you know, the word mental itself is very much, you know, taboo. Okay, or it is definitely looked at in a derogatory manner. That's a huge myth. It's just physical health, just the way it is physical health, it's mental health. But I will not blame anyone, it is basically that's how it has evolved over the years. So, whether, I mean, I could have come across, there's a lot of social ostracism related to it. Like something which is, you know, not to be discussed or should not. I would like to share a particular client. Okay, I use the word client for patients. I don't refer them as patients, okay? Because my approach is client-centered therapy. So whenever I use the word client, I mean, it means fresh patient, okay? But anyway, so there was this lady who called me for an appointment, saying that, you know, I would want an appointment. I said, great, this is the time available, this is the slot available. And she said, okay, I'll confirm. Then before she, you know, hanged up, she asked, is there a board outside your office? I said, not really. I mean, only by appointment, so I don't need to keep a board up. Thank God, you know, I don't want that board to be there because I don't want to see the watchman or the lift guy coming to your office. Yeah? So that is basically, she was looking forward for an office which did not have any tag or any tags or any strings attached, basically. No one should know that she had visited me so. So I can clearly see that there is a lot of taboo related to it, and there are a lot of myths also. When I speak about myths, you know, these days in popular media, a couple of psychology words have come up. For example, usko to OCD hai, you know. The word OCD has started floating as if, you know what, it's an expert diagnosis by everyone. So another thing is depression. Okay, I'm depressed. Someone just says depressed. You know, when I hear this, again, this is awareness, and I would want people to know this, that certain words like depression should not be used casually because there is a diagnostic criteria. Okay, so let me tell you about this guy who says that he comes to me and he says that, you know what, I need your help. I said, yes, that's what I'm here for. What happened? I'm depressed, he said. When someone says that, my very first question is, since when? Okay? And he says, since morning. So I said, no, you can't be depressed since morning. Okay? Because, what is depression? If I put it in very lay terms, when you are feeling sad for more than 14 days, 2 weeks, along with 3 symptoms, okay? Feelings of hopelessness, helplessness. Second, feeling negative, pessimistic about life. And third is fatigue, okay? Fatigue, physical fatigue. These are the 3 basic, there are more, but these 3 factors have to be along with you feeling sad for more than 14 days. If that is not there, people should not self-diagnose themselves as being depressed. Because if they do, then it is equal to saying, when you get common cold, do we say I am suffering from pneumonia? No, right? There is a difference between common cold. When you get cold, it's cold. But when you don't treat it properly, there are high chances of common cold to lead to pneumonia. Similarly, when you are sad, okay, work on that sadness, okay, and I always say that you have 14 days to work on it, work on it. You can work beyond that if you don't have those three add-on symptoms, but at least keep a timeline, okay, I need to work on this for 14 days. Now, how will you work about it? We will come to that later. But like I said, there are myths associated to self-diagnosis because these days people look up and history also matters sometimes. For example, anxiety and ADHD, okay, can be, may have the same symptoms. Sometimes people can say, you know what, I have ADHD. I said, wait, let me figure it out. Let me understand your history. Is this coming from an anxious background or is it actually related to ADHD? So my point here is a lot of data is available out there that might mislead people to self-diagnose themselves. So I will highly recommend you all to approach a counselor, a person who a counselor, psychiatrist, or psychologist. Coming to this also, many people are not aware about the difference between a psychiatrist and a psychologist. I need to make it very clear because this is mental health awareness, right? So, as per the Indian standards, okay, I'll speak about the Indian standards here. So, people doing MBBS, medical degree, and after that doing either MD in psychiatry or a diploma in psychiatry can practice as a psychiatrist. They have the, what you call, the permission by the government to prescribe tablets, injections, and also in extreme cases, shock therapy also. They are the ones who do that. So they have a medical background. When it comes to a psychologist, okay, I'm a psychologist, we are having a humanities background. Okay, my degree is a Master's in Arts, MA Psychology from University of Mumbai. And out there, counseling techniques, counseling tools are used where psychotherapy is basically the tools that we are taught so that this particular client happens to gain first at a psychotherapy level. So we'll come to that later as to what exactly can be covered in psychotherapy. But talk therapy is the first therapy line of action sort of. Also, when you go to a psychiatrist, obviously their first line of action is to biologically stabilize you on whatever is bothering you. But when you go to a psychologist, there's no medicine that is going to be prescribed, no injections or shots, of course. It will only be on the terms of speak it out. So on the basis of logic, on the basis of lifestyle changes and mindset changes basically. So if I put it in very small words, okay, as per my understanding, I'll use a Hindi line also here, okay? Mind management is very simple. If I put it in one line, या तो परिस्थिति बदलो, या तो मनस्थिति बदलो. Yeah. Either you change your lifestyle and bring about the positive change. Wherever you have control, change your lifestyle. Where you don't have control, change your mindset. If you do neither, you will be in the middle, and that's where psychological problems will start breeding out there. Okay, people who don't do either of it, they'll end up into that no man's land basically. Okay, so having said this, myths are clear. Okay, now let me tell you about the 3 Ds. Again, another thing that we need to be very clear about. Let's come. Okay, there's something that is disturbing you at the mental level. Okay, so like I said, everyone like OCD and depression. Okay, when we talk about OCD, depression, panic attack, okay, these are disorder levels. Okay, so not everyone who's experiencing mental issues directly lands up into disorder levels. As per my understanding, okay, there are 3 Ds. Remember the 3 Ds. Whenever you feel disturbed in life, mentally something is bothering you, the very first point, the first level is distress level. Okay, that is distressing you. Distressing you means you're normal, basically you're in your normalcy, no doubt, but you're a little bit deviating from your normal routine of life. Okay, that something is that maybe it could be a relationship issue, it could be some financial issue, anything which is actually deviating you from a basic normalcy basically. So you are in distress to begin with. Now when you don't when you don't take solutions at the distress level, then it gradually lands down into a dysfunctionality. church, but now he's not going to the church. Okay? Workplace, he's going but he's not into it properly. And because of which he's getting complaints from the manager and all of that. You know what, these days I'm noticing you're not focused well. There are high chances this guy has led into dysfunctionality level of his mental health issues basically. Now, when dysfunctionality has occurred, at least that point of time one has to take charge of. But when dysfunctionality level is also not, interventions are not happening at that level, then it leads to disorder. So when people talk about, I'm in depression, and actually they are in depression, they are in the disorder. What was happening when it was going into dysfunction? What was happening when it was getting distressed? If no charge is being taken there, definitely, gradually, a person will land up into disorder. That's what I'm saying, when people say directly they talk about disorder, let's talk about distress levels as well as a dysfunctionality level. Having said this, so when it comes to these three levels, let's take a client comes to me. In the very first session, I come to know where is this person in his journey. Is he at a distress to dysfunctionality level? Is he from dysfunctionality to disorder level, or actually this person is going to a full-blown disorder? So that is important. This all what you are understanding at your own level, if you can do that, you can actually be more help. It will help you know to approach people and say nothing to him. It's like this, when a person gets injury, it is important to treat it when it happens, right? Otherwise, the bacteria is going to hit it. And then it might go and the hand might stop working. When the hand stops working, it has gone to the dysfunctional level, right? And when the septic or something happens, absolutely, then it goes to the disorder level of that particular organ is what I'm trying to say. So this is clear, right? Moving ahead. Markers of good mental fitness. Now let's talk about markers, okay? What are the markers of good mental fitness, okay? So when we see let's talk about physical markers, okay? When you see a person, okay, let's say if these boxes out there, if someone says that I can lift that box, that heavy box out there, and someone comes and actually lifts that box. When we see that person lifting that box, we definitely understand, oh my God, this person really has physical strength to, because of which he has picked it up, right? But when it comes to mental health, what exactly? There are many markers, but I want someone to, I want an interactive session here. What do you think is the marker of mental health, like mental strength? See, biceps, triceps, and abs, and all of that we watch in people, and you say, okay, this person can lift so many loads. Definitely, he has the physical stamina. How do we calculate the markers? What are markers? Body language, yeah. Okay. Okay. She says body language, face, all that, right? Yeah. Definitely, whatever answer we are looking for is a part of what you said is a part of that. If that is there, then the body language will be what you are saying. So, yeah. Yeah, partly she's right. Yeah. Positivity. Patience. Okay, assertiveness, that is. Yeah. Right. Exactly. That's right, yeah. Personality traits, yeah, which is basically, see, all of y'all are saying the right thing, and if that one word has to be calculated, she has already mentioned that, okay, which is basically positive attitude. If a person has a positive attitude, that's the marker that this person is mentally strong. How can one parameter, that's just one thing, will encompass everything? For example, when you mentioned, your input was, body language and, what you call facial expressions and all of that, that will only come if the attitude is positive. If the attitude is negative, it is going to reflect in the body language. So if I'm afraid, my body language becomes scary, right? So finally, it is all about your attitude. And positive attitude is what we are talking about here. If you see someone having a positive attitude across, you mentioned across in different situations, not just in one situation. is mentally stable and mentally strong sort of. Having said this, where do we get this positive attitude from? Can we go to a chemist and say that I do chamach dena? You can't go to a chemist and say that, you know what, I need positive attitude pills. No. Okay.
Within you.
Yeah.
It comes within you.
Within you. Okay, within you when you do something. Okay, when you actually are influenced by something. That's what we come to. We are going to discuss exactly how does this all come up, right? So when it comes to experiences, and again, positive experiences or negative experiences, we are going to discuss that. So if positive attitude is the marker, is the one single marker that this person is mentally strong. But there's a disclaimer here. Some people just say that, or they might wear t-shirts of be strong, never to quit. You see that? Apna time aayega types, yeah?
Just fake it.
Be calm.
Fake it. They
Mask
fake it.
it.
They mask it. Okay, so it's important to understand, is this positive attitude coming from within, or it's just a superficial expression of that person? I'll tell you about something, okay? On this note, I'll tell you. As per my observation, I'd like to share that when people wear a t-shirt or DP, let's talk about a DP, display picture, okay? I would like to share this as a trivia, okay? So, when I see a DP which has a quote like, I'm the king, okay? Or I can make it, or all of that, something like that. Now, when we see it as spectators, we say, oh my God, this person is quite confident and very much, positive. Okay? Remember always, when you see a positive, DP or someone wearing a t-shirt which is positive, that the interpretation of that could be this person is really positive or the opposite of it. Always it's the same or contrast. Now but if there is a negative DP or a negative t-shirt, it means negative. So why am I giving you this data is, if you have friends, close people who are displaying very positive messages on DP and all of that, okay, you may consider, oh, everything is fine with this person, but may not. Maybe he wants to reach there what he's talking about. So call him and ask, are you alright? Particularly if he's posting those messages again and again. That's how you, figure out, there's something wrong here. I hope you understand, because that could be deceptive. Positive could be deceptive, negative will not be deceptive. That's my point. I hope you get the point. So I was telling you, okay? So, and if you see a pattern, recognize that pattern is what I'm saying. Okay? So positive attitude is, I'm talking about the internal, genuine positive attitude I'm speaking about. You'll have to figure out ये fake वाला है and this person is really coming from it. Now, another marker that this is genuine or this is just superficial is, many people think, a positive person should not express to anyone or should not cry, okay, or, he or she, okay, will be everyone's rescuer and all of that. They think this is the marker of positive attitude person or positive thinker. No, that's not the case, okay? That won't tell. When will the real test, when is the real test that this person is truly positive? That's when adverse conditions come in life, when things are not going smooth, that's when your attitude can be tested. Okay, in the worst of the worst condition also this person showed positivity, that's the genuine positivity. Because when the negative conditions come, okay, that time what is fake and what comes from within will be marked, is what I'm trying to say. So I'm telling you the second marker of what's genuine and what's fake sort of, okay? Of course, I'm not saying that people who do not show, great grit and other things in negative conditions, probably they are work in progress, okay, we need to help them, but understand that, the real test of positive attitude will be seen in negative times basically, okay? Like they say, the darkest of the darkest night, in the darkest of the darkest night, okay, let's take, someone is down into this particular chamber where there is no light at all, right? And then there's just one small hole in the roof from where a beam of light comes, okay? That's what positive attitude does. In the worst of the worst condition, that little speck of light also lights the particular dark room, those people are in that manner sort of. They will always see the positive in the negative basically. Okay? Having said that, how positive, yeah. How positively charged we are. Now let's talk about the charge concept, okay? Like we said, it comes from within basically. Yes, it comes from within, but always the processes, the protocol is, if it has to come from within, it has to go in first. Yeah? So where does it come from? It comes from out to in. Let's take a piggy bank. If I put 1 rupee every day in that piggy bank, I want 30 rupees at the end of the month. I put 1 rupee every day. At the end of the month, when I open the piggy bank from down, 30 rupees will come. How did these 30 rupees come? Because they went in, so they came out. Yeah? So it's very, very important. Of course, our influences matter. So then, charge. For example, we have this cell phone, right? We have this cell phone, and this word charge is associated to charger ki tarah, right? The phone doesn't charge from within. The phone charges from outside. And then it becomes a part of this phone basically. Yeah? So always that's the case that what are our influences? Are we being positively charged or not? And that's what we are going to speak about. Okay? How positively charged you are. What charges us or discharges us. So the whole idea is, now when we say, oh, my cell phone is, cell phone charge is coming down. So what do? We charge it. And once we charge it, we have to keep charging it every day, time, right? Because it will discharge, right? That's the whole idea. It will discharge. And we have to accept it कि एक बार भर दिया तो थोड़ी उम्र भर रहने वाला है. It's not going to stay for long. It is going to come down. It is going to discharge also. What do then? We again recharge it, right? Similarly, when it comes to our mental health, positivity doesn't last forever. Okay, we got to charge ourselves positively, then use that positivity, and apply it in various conditions. And there will be external factors also that can damage our positivity. But what do? We recharge ourselves, right? That's the whole idea. So what charges us, okay, or discharges us? And the answer is emotions. Okay, emotions. Now we talk about emotions. Okay. Emotions are the thing, it's like the charger of our mental health. Okay, how charged you are you positively charged or are you negatively charged? Depends upon the concept of emotions. Now we are going to talk about emotions, but understand next time when you see your charger, remember from this talk, oh, this is the emotions that she's talking about, okay? And obviously there is no charger that discharges our cell phone, right? Chargers always charges, right? So similarly, let's talk about emotions, okay? Yes, now let's understand emotions, okay? What are emotions? Now we are going to understand emotions because I will help you understand how do you positively charge it. When you get negatively charged, what exactly happens, okay? So, what exactly are emotions? Many people know about sentiments, feelings. These are the layman's word towards emotion. Feelings or sentiments. But see, technical psychology books will give various theories of emotions and all of that. I don't want to go there. I have created a small, simple model for everyone to understand exactly how do you interpret emotions basically. Okay, just the way we have 5 external sense organs: eyes, ears, nose, tongue, smell, and touch. These are the 5 external sense organs. Okay? Now, similar, what do? They sense, right? The eyes sense visual data. Okay? The ears sense auditory data. The nose smells olfactory data. Okay? And when this data, what do we do with this data? Now, for example, if I'm walking like this, okay? And when I see that there's a chair, what do? I just go besides and I walk away, right? What if why did it happen? Because my eyes gave me a visual data that there's a chair, you might get bound to it, so be careful. So I get aside and I move on. This is simple logic, right? Similar, and so these 5 external sense organs sensors of our physical body. They are sensors, okay? That physically there is some problem, okay? That, for example, now also, when the sound was getting loud, our ears say that this is loud, this is going to hurt. Lower it down, right? Because we want to protect ourselves, right? On the same lines, our emotions are our mind's sensors. And what are how many emotions are basic to our mind? 6 emotions. Happiness, sadness, fear, disgust, anger, and surprise. These are primary emotions. These are basic emotions. Even a just born baby will be having these, active. Now you'll say, what about love? What about patriotism? What about jealousy? These are also emotions. But why are they not covered here? Because they are secondary emotions. Why are they called secondary emotions? Because just the way there are 3 primary colors and all other colors are the permutation and combination of the 3 colors, similarly, let's take jealousy, which is a secondary emotion, is a permutation and combination of these 6 emotions. Let's understand the emotion of jealousy. When a person is jealous, isn't that person having sadness in them? Okay? Of course, like they're sad that that she has what I don't have. Or if that out of jealousy she is trying to prick someone, she's feeling happy about it. You know what I'm trying to say? So there's an element of happiness. Let's take jealousy of losing someone. This girl's boyfriend is hanging out with someone and she's feeling jealous about it. There is insecurity, that is fear. So you understand secondary emotions are permutation and combinations in proportion of the primary emotions. That's why they are called love. Love is an emotion. Love is not in the basics. They are in the secondary. Love will have all of them. Yeah? At given different point of time, yeah? Happiness. Many say, oh, love में happiness होता है. नहीं, sadness नहीं होता if that particular person is going at. हाँ, टूट गया तो डर है, टूट गया तो डर है. There's fear in that. So you get it, right? Because these are the 6 emotions. Okay? Now, on an everyday basis, we experience these 6 emotions. Okay? Right now also I was coming from Kandivali and I was like, I hope I'll get on time. I hope I'll be on time here because airport side there was so much of traffic. So what touched me was fear. But it was at a distress level. It was not at a dysfunctionality level and disorder level. OCD ho gaya. Yeah, you getting it? It's at a distress level. Obsessive compulsive disorder. Obsessive compulsive disorder, where a person is absolutely obsessed with a particular theme, and compulsion is basically the action based on that particular theme. So let's take, have you seen the movie Dark? Dark has OCD, that guy, that Kiran Kalaba, is obsessed about this girl, okay? And it's not just not obsessed, but everywhere calls her. So calling is an action, right? So he also has compulsion in it. Obsession is you don't do any action, you just think. But compulsion is an action, what you think you are actually doing. So see.
Yeah, there are like some people who like things to be cleaned again and
Clean,
again,
yeah.
like washing.
Hygiene, OCD. So there are themes. OCD will have a theme. Okay?
Attention deficit, affection deficit, hyperactive disorder.
Attention deficit hyperactive disorder. Okay? We have a Q&A.
Emotions.
Yeah, so at a distress level also you can experience these emotions. So when it is at a distress level, you come back to your normalcy basically. Okay? I reached here on time, I called Evelina, sorted. My, distress level, fear went away, sorted. Okay, which is completely normal. Now, the whole thing is, let's go, this is introduced, right? Now the next thing is, I want to ask a question to you. Which emotions are good and which ones are bad for our survival? Or 65-year-old lady, okay? And definitely she had a royal family heritage. So money was not a problem. This actually happened. She comes with her, aura, and she comes and sits in front of me. Without saying anything, she removes a checkbook and she signs a blank check. I kept looking, what's going on? And she puts in front of me and she says that, you know what? Tell me what amount should I put? I said, for what? I have still not started my case. No, you tell me I will sign this, but do something by which I'll be happy all my life. I have gone through a lot of trouble, I have gone through a lot of pains and all of that. I have gone to n number of psychiatrists and psychologists. I'm done. Okay, someone gave me your number, they said that you might help. I there understood that she definitely is in desperate need of some sort of happiness in her life, but this is misleading because she doesn't want any other emotion. She just wants to be happy. So I said, please keep the checkbook inside. You need to understand something here. That somehow I create some magic and I make you happy. No other emotion, only happiness. That is going to be dangerous for your life. How can that be, Shraddha? She says. How can that be? No, I don't agree to you. You don't know what pain I have gone through and all of that. I said, I understand. I empathize with you. Even if I've not heard about your desperate case situation only tells me what level you must have gone through. But trust me, only having happiness is not going to help. Tell me how. That's where I said, listen, let's I do some jadoo now, okay? Some magic, okay? And you become happy, no other emotion. And then you are going for a trek. Yes. Which is climbing mountains. She goes into a forest. And there comes a poisonous snake. And she's happy about it. Okay? The snake doesn't know she has been, done some kind of a magic. The snake is going to feel this woman is going to hurt me. And there are high chances of it to bite. And when the snake comes in front of her, she is supposed to be afraid. She has to be afraid so that then she can either fight or either she can run away. That's the way it is. So if you are afraid, there is a reason for you to be afraid because that is your mind's way of telling you are in danger, do something about the situation. So for that, if the fear sensor is not working, what's going to happen, right? That is the reason you see these bulbs. I know there should have been 6 bulbs out there, but I did not get a photograph of 6 bulbs. These 6 bulbs, assume that these are 6 bulbs. They are the sensors of our mind. These are the 6 emotions. So next time you feel afraid, the fear bulb is glowing in your head. Okay. The fear is telling you something. Just the way the eyes told me, Shraddha gets side, you'll get hurt. Similarly, fear, when you are afraid, experiencing fear is telling you something. That some things around you are not okay for your survival. Okay? Or if happiness, you're feeling happy at a particular point of time, it is telling you, what, everything is, all is well. You know that all is well line here? All is well and all is really well. Okay? And fine, when you are angry also, many people say, nahi, gussa nahi hona chahiye. Your anger is not good. That's the whole idea. Every emotion has a positive as well as a negative. Emotional intelligence is that where you exactly know where and when to use a particular emotion, where to stop and where to react basically. Having said that, have to react and then also respond also. So having said this, for example, I'm talking about anger. Okay, it is this anger. So that's the whole idea. Is anger being used constructively or destructively? If that anger is used for constructive reason, anger is good. Daag achhe hote hain wala hai na? Yes. Yeah. Similarly, anger will be considered as good if that anger has come to some but positive use for you or the society. Giving you a simple example, when Mahatma Gandhi was pushed out of the train in South Africa, he was consumed by anger. And that anger itself said that I'm not going to hurt this guy, I'm going to get into the freedom struggle and push the British Empire out basically. When that happened, Okay, that is the anger that got converted into a particular, freedom struggle basically. I'm not just talking about Mahatma Gandhi, but many other Martin Luther King and other revolutionaries and also freedom fighters across the world. That is the anger towards a particular empire for it to move outside. So what I'm trying to say here is basically other day, someone belittled this guy. Okay, you cannot do this. Okay, you are not made for this sort of. He became angry. He could have slapped him back, but he said, wait a minute, let me convert this anger into something constructive. Anger is like fire. And then, I always give an analogy of rockets. You see, rockets cannot go up without fire being, placed down. Okay, so if the placement of anger is proper, you will skyrocket in life. But if that fire happens inside the rocket is going to blast. So that's the whole idea. How are you using that anger? In a constructive manner or in a destructive manner? That matters. I'll tell you, how can happiness kill? I'll give another example. 5 years back, there was this situation that happened. Madhya Pradesh is a waterfall in Madhya Pradesh where there was no water accumulated because it was many vacations. There was one particular line where it is mentioned that don't go beyond this, because after that is so-called a danger zone. Though there is no water, but don't go. There was a demarcation. But some tourists happened. They went in next level of euphoria, dancing, playing, and all of that. Some of them probably consumed alcohol or something like that. Happiness went to the next level, euphoric levels. And then they moved ahead of that particular road where it is mentioned no going ahead of this. In that happiness, in that fun, in that euphoric level. These guys go inside where the rocks are there and they did not know. Somewhere far the dams had opened. And within half an hour that water came gushing and these guys unfortunately passed away. Now here, happiness killed, right? What would I say of them? Fear. Fear of not crossing this line. I hope you understand.
Yes.
The point is, all these emotions are there for our well-being. So far, you exactly understand where to start and where to stop, or where to calculate that this is enough. Because all these emotions have to be in balance, experience reason. Having said this, so what all emotions matter? Okay? If you've seen this movie, anyone has seen this movie Inside Out? I will highly recommend you to see the movie Inside Out to understand in a very entertaining manner what I exactly told you right now. Okay? Now, let me tell you about the biochemistry of emotions. Now, this is the most practical part of it. The biochemistry of emotions. Okay? The basics of happy hormones or happy chemicals. I will use the word happy chemicals. Okay? Remember, there are these 4 chemicals: dopamine, oxytocin, endorphin, and serotonin. This may sound technical, but believe me, they are very. Once it goes into your system, you will start thinking from these 4 points. Okay. So dopamine. There is the features are there, there are the dopamine high. Out of 4 to 5, I will only say that it is considered to be the reward chemical. It's considered as a reward chemical. Many more things, but just if you keep in mind a reward chemical. Oxytocin is the love chemical. Okay, you feel the bond of it. Okay? Endorphin is the joy chemical, and serotonin is the calm chemical or pride chemical. So why am I discussing this? Why am I discussing this? I'll give you an example. Let's take if you are entered a competition, okay, and you win an award, and you feel nice about it. What will release in you? Dopamine. And when dopamine is released, you are going to feel like the king and the queen of the world types. So what am I trying to say? That these feelings cannot be possible if these chemicals are not released. Okay? Let's talk about serotonin. Serotonin is a calm hormone. It creates calmness. Let's say we go to a hill station and we are experiencing the calmness out there and you're feeling nice and calm about it. It is impossible for you to feel the calm if serotonin has not released within. Okay? Let's talk about oxytocin. oxytocin is released.
Even when you eat chocolate,
Yeah, chocolate is endorphin. Chocolate is endorphin. Okay. See, right now also we all are meeting. We are saying hi, hello. There's a community life happening, right? Oxytocin releases. During the lockdown, all these chemicals had gone for a toss. Yeah, particularly oxytocin because of the physical distancing. You know, they were using this word social distancing as per my understanding that it should have been a physical distancing. We were socially connected. It's the physical distancing. And when you positively touch someone, even shake hands, oxytocin gets released. And it is the same chemical that is released in the mother and the child while she's breastfeeding, basically. Yeah? This is the same bonding chemical sort of. And that connection later on we start finding in friends, in community members and all of that. The least we can do is shake hands or give a nice, genuine hug. So that you know what? It releases for that person also and you also basically. And the more and more oxytocin is in you, I mean it's flowing in you, you'll start feeling, you know what? I'm not alone. That loneliness, it is an anti-loneliness hormone, I would say. Oxytocin. Next time you feel lonely, it is the oxytocin that you need to start releasing. How do you do it? By changing your lifestyle. That's what we're going to understand later. But lifestyle changes that you know what? Oh, connect, church, attend church, where you meet people, you hug them, you know, shake hands with them, you actually call them for lunch, you know, and all of that. When you do that, aren't you bonding? And when you're bonding externally, what internally is getting released? Oxytocin. And that oxytocin is going to help you to really feel that you know what, I'm not alone and I can keep going basically positive. Okay? Endorphin is basically a pain reliever. Endorphin. Okay, now talking about endorphin, I need to tell you this. It's a pain reliever and it is body's natural anesthesia. Okay? You don't feel pain when endorphin is released. Okay, it's called the joy hormone. Okay, did you notice in school or colleges, you know, or rather picnics? Okay, we do a lot of activity, you know, and you're enjoying, you're having fun with that activity. Endorphin is getting released. That time you won't feel the pain.
Shopping mall, 3 hours you walk, you don't feel the pain. The moment you go home,
Exactly. The moment you go home or the next day, everything is all done. Why? Because the endorphins are no more there on the second day. But endorphin will be released when you are doing something that you love, something that gives you pleasure. Okay, so endorphin acts as a painkiller, also research proof fact. And I'll show you a video related to that later also. Your immune system, physical immunity, okay, will be up if the endorphins are up. If endorphins come down, your physical immunity also comes down. Research proof fact. During the COVID, it has been also researched that people who were in, you know, who were having endorphin release, maybe they are doing their favorite activity or they are doing something that will create pleasure for them, joy for them. They were in a mindset that is endorphin oriented. People who suffered COVID in that endorphin, either they will bounce back soon or they will not get affected by that particular virus basically. The whole idea was, you know, before physical immunity, your mental immunity needs to be strong and the mental immunity hormone would be endorphins. So love what you know, what you like basically. You know, do what you like, at home front, whatever can you do in the room, do it. And anyhow create endorphin within you, is what I'm trying to say. Okay? Anyways, coming to serotonin all is done. Next is cortisol. I did not speak about the sorry? Dopamine is the reward chemical. Okay, whenever you get rewarded, okay, you definitely feel that also in terms of serotonin and dopamine, these are the two chemicals. One is the calm hormone and the pride hormone. When I say pride hormone, I did not tell you this. When I say pride hormone, serotonin is equal to self-worth hormone. Whatever you feel nice about yourself, okay, I can dance well, okay, or I can cook well. When you say that with pride, okay, and you genuinely say that with pride, you are releasing serotonin. So do things that are dopamine releasing and serotonin releasing at a balance level. Remember, all the emotions have to be experienced in balance. Next time if you are feeling sad, you know what you need to do. Serotonin up karna hai. You know, because serotonin low for more than 14 days may lead to depressive conditions. Okay. Having said this, let's talk about the cortisol, the stress hormone. We spoke about the positive chemicals. Now one is, when I say negative, that doesn't mean we don't need it. I just mean to say that about the negative emotions associated with cortisol. When cortisol is released, when is cortisol released? When you get irritated, okay, when you get frustrated, when you feel life is done, I'm done with life and all of that. It is impossible without the cortisol getting released. But like I said, it releases for some reason, right? We need to do something about it. So it's like when the phone charge is coming down, maybe if it was a human being, cortisol would have released in that phone. You know what I'm trying to say? So what do? We take the phone and we throw it away? No, right? We charge it. Similarly, when you feel frustrated, you feel irritated, do we throw ourselves out? No, we recharge ourselves, right? But let me tell you a statistics out here, which is on the screen itself, that when cortisol is released, when you don't do anything about that cortisol, it is there inside you. When you don't do anything about it, look at what happens physically. Digestion shuts down, increases blood pressure, suppresses thyroid function, also delays ovulation here, that means the reproductive organs of a female especially, as well as male also. It has been seen that cortisol influences the reproduction capacities of humans, okay? Blood sugar levels increases. If cortisol is there for a longer time, you are not doing anything about it, okay? And the last one is impairs immune system. We spoke about that before. Today, a lot of youngsters are getting diabetes early in life, okay? Also blood pressure. And in female, I have seen either thyroid problem or PCOD. These are the two main things, hormonal issues. The biggest reason being cortisol being in the person, cortisol being for a longer time. Cortisol release is okay, but you're not doing anything about the cortisol release. Maybe the conditions are not positive enough for them to really change basically. So today a lot of issues are happening because of the cortisol release, okay? Now let's talk about power of emotions, okay? Like I already said, emotions are essentials for one's constructive growth. I already discussed this. If not managed well, emotions cause destructive consequences. I did discuss this, right? Based on that, we have one video regarding immunity. I already discussed about this video as to how during the COVID times, positive-minded people newspapers saying that, COVID count is increasing or whatever it is, so far you are happy and releasing the endorphins and all of these positive chemicals, trust me, you are safe, okay? Even if something happens, you'll bounce back, God forbid, but I'm trying to say that, no, I'm making this awareness because do not be afraid. You know what happens is, already the lungs are gasping for air, right? And when you are stressed, okay, people gasp for more. So because of these viruses, people may not go away. It is basically the heart might get, stressed more sort of. So, and under any condition, don't allow the cortisol to overpower you. Is what I'm trying to say. Okay? Do something about the cortisol. So, destructive and constructive. So the thing is, if negative emotions happen, and if you don't do anything about it, definitely they are going to destroy. If positive emotions happen, you don't have to do anything about it. Right? So the moment negative emotion comes, you need to process it. You need to do something about it. And what is the something? We are coming to that. Because when you show things under the carpet, process it and show it. Then it won't matter. So I always say this, you know what? If something has hurt you in the past, it could be school levels also, college levels also, anytime. You say, oh, it was dead, it's all done and dusted. But many times, if you have not processed it positively, it's shoved under the carpet. And later on, if more things build up, okay, that carpet starts stinking. When I say stinking, negative emotions will start bubbling down there. And just like a leakage happening, okay, how leakage happens? Let's say a particular pipe has messed up of the upstairs, neighbor. The water needs to come out of the pipe, right? But it's not coming out from the pipe, it's coming out from the walls. Walls are not supposed to give out water, but why is that happening? Because somewhere there's a mess up somewhere, right? Similarly, I have seen people who have not worked over their emotional traumas and that has kept building, high chances that might come up somewhere else, just like leakage happening. So some skin disorders are connected to mental health, okay? Digestive problems are connected to mental health. Because that mental health problem was not dealt, it's now showing up through their stomach. So skin and mental health connected. Stomach and digestion and mental health connected. Migraines, headaches and mental health connected. Okay? Then what? Heart health, cardiac, okay, diabetes, blood pressure, all of this are connected because they are not taking care of their mental health at that particular point of time, or rather built up happened, now it's leaking out from somewhere else. I hope you understand what I'm saying. And the worst cases also I've seen is, the certain cancers are also linked to mental health sort of. So it's highly recommended, sort your mental health, you sort your physical health also. एक तीर से दो निशान बोलते हैं ना, वो होता है. That I will also save money also, right? Yeah? Anyways. Now, that's all. Now we're talking about how to deal with negative emotions, that is toxic emotions. Like I said, if you are experiencing positive emotions, you don't have to do anything about it. You just enjoy and be in the moment. If negative emotions, you are not able to deal with it or process it, we need to talk about that, right? So that's what we are going to do. First, let's understand what generates negative emotions. When do these negative emotions happen and stay there for long? See, the whole thing is, let the negative emotions happen. But they coming and staying with you is the problem. You got to deal with it in a positive manner. But let's understand, because see, the whole idea is, what's the logic here? The more positive emotions you experience in life, the more positively charged you will be. And if you're positively charged, absolutely your attitude will be positive. That's the link. That's the link. Okay? So that's the point we are understanding it. So if a person is if he is experiencing negative emotion all the time, or chronically has been experiencing negative emotion, then this person is negative generated at that point of time and stayed there. And this person is living along with that, early childhood and teenage abuse. It could be physical, hitting, hurting, and that child could not do anything about it. Okay, or physical, sexual, emotional abuse, and social abuse. All these kinds of abuse are connected to the first impact of negative, experiences by which this person always has this thinking, world is like this only, and everything after that, the same pattern they might go on. Okay, that's the thing. Okay, second thing is, it has been seen, feelings of worthlessness. If a person starts feeling worthless about himself or herself, negative emotions will be generated and it will stay there. That's a trauma. Okay? Leading to inferiority complexes. If people are living, if anyone has an inferiority complex which they are living since long, then that is a huge emotional block, negative emotional block in their mind. And when I say blocks, I'm coming to that. Let me first discuss all this. Unprocessed emotional trauma. It could be a relationship breakup. It could be loss of someone. Okay, it could be anything that's an emotional trauma, but it is unprocessed. Because when I say unprocessed, closures are not brought to it. That person gets nightmares about it, or thinks about it, or gets triggered by it. Okay, that also is one area because of which emotional trauma, toxic emotions happen. And maladaptive and rigid belief system. It has been seen. The fourth point is, like, once upon a time they had this belief system. And today it's time to change for good, but they are not changing. They are still sitting with, or they are nurturing the same belief system, because of which today things are not happening the way they expect them to happen. So if you have seen the movie Mohabbatein, where Amitabh says, "Mujhe parivartan pasand nahi hai," he is so rigid that he will go his way only. His children want to, some different life, but he is not ready for it. So then what? They leave him. And logically speaking, it's time to adapt, but they are not ready to adapt. And then they will blame the world that, see, everyone is behaving like that. So many times, rigidity and non-adaptive approach also generates negative emotions. Having said this, but these are just few of them. There are many more many more parameters that can generate negative emotions, basically. So at any given point of time, okay, let's take if a person is 25 years or 40 years. So I'll tell you one of my process. When the client comes and he is telling me or she is telling me about his life, and if it actually has a lot of traumas, okay, I sense that, until and unless these traumas are not worked on, this person's productivity will suffer. So just like an angiography is done, an angiography done on the heart, the arteries of the hearts are checked of how many blockages are there, okay, of the fat. Similarly, in my case study, I scan, there's no scanning machine, it's just an interpretation here. How many emotional blocks are there in this person's mental system? Is there a physical abuse done in his life or her life? Is there an inferiority complex? More number of emotional blocks, lesser the productivity. So it's very, very important to really remove those emotional blocks. Until and unless people don't get out of that emotional blocks, it's do I do that particular, what is that process, bypass, angioplasty. Do I do angioplasty? No, I don't know. It's so abstract. You can't do plasties and all of that. It's a process and it takes time, okay, to get to closures. Okay, that's where the therapy part comes. No injections, no medicines. We start with empathetic listening. Okay, empathetic listening is say what happened. Okay, I'm there, but it's not so easy that you come and you start saying no. Rapport development has to happen. That person should start trusting us. Unless and until they don't trust us, that's the technique of a counselor. That under unconditional positive regard. What does that mean? Unconditional positive regard. It's that non-judgmental. Whatsoever they say, okay, we have to accept it as it is. That's the skill part. So let's say if he or she says something. Oh, how did you do this? Did you feel ashamed about it? What is this? This is judgmental. Do you think that person is going to share anything with Never. Rather, he will tell 10 more people, don't go to her. But let me tell you this. What I just said right now, a mother, a sister, a friend, if she or a brother or a father also does this unconditional positive regard offering to their child, okay, tell me what it is, I'm there for you, sort of, then definitely that is the first line of action. Why do you think people are not wanting to share? Okay, why do you think people are running away? Because they fear that, I'll be judged. On my sexuality, on my looks, on my, all these things. That fear is keeping them away. Because unconditional positive regard is what is lacking. And if that is there, believe me, India or our community will be much more mentally, stronger. Because at some point, there is one person in life who will see me for who I am. That is required, okay? But anyways, counselors are trained, and the very first session we don't have to do that. We'll have to see some people have trauma, trust-related trauma. They don't trust, okay? There are people who don't even trust the counselors for the first 3 sessions. They ask, किसी को बोलेंगे नहीं ना? I just have his number, Who else will I tell, right? But I have to tell them, don't worry. And I have to allow them to take time to trust me, basically. Once they start trusting, okay, that's when, the process starts. And it's like, trust is like this, when a nurse, okay, starts searching for the vein, the right vein, and that right vein is achieved, then the feed or that particular, what you call intravenous will start, right? So we counselors search for that trust vein, what I'm trying to say? Then everything will start going. Okay? And by we counselors, I will suggest all the relationships that you have, remember, that is how, आपका सुनेंगे, लेकिन trust के बिना नहीं सुनेंगे. Exactly, unless trust is established, no, everyone is going to be defensive about it. Having said this, like I said, one has to introspect that how many blockages have happened, emotional blockages are there. If at your level you cannot work it out, go to a counselor. That person is going to help you regarding removing those blockages. Like I said, just a quote, unexpressed emotions will never die. They are buried alive and will come forth later in uglier ways. Did I tell you about the leakage thing? Leakage thing, that is what I'm talking about. So it's important to sort it out. Maybe even though if it is 10 years, 15 years, it's all right. Okay, but one needs to really come to that realization, I need to work about it. At the least, just get it out of your system in a right protocol. That also helps. Because what happens is, I'll tell you, many people tell me, no, I don't want to talk about all of that. Let's take it, they are abused or they have some really pain associated with it. I just tell them one thing. This is the last time you have to tell me. Because then you tell me the solutions. I said, until and unless you don't express me exactly how it happened, no healing can do. But why can't? The answer is this. When anyone gets injured, zakham ho jata hai na? And that particular injury starts getting infected, and pus formation happens. This person goes to the doctor, and the doctor says, okay, let's clean it. They clean it. Then, if the pus has to be pressed and removed, it has to be removed, right? So, hurt is going to happen when the pus is going to come out. But until and unless the pus doesn't come out, no medicines can be applied in that. Yeah? So, that is the reason one last time you have to say that or express it. It is like, some toxic stuff coming out, and then the therapy can be given. That is how it is. And believe me, how many people said, okay, I will speak about it. And then they say, of course, I will not. So it's always now when they speak about it, it's literally a surgery on the mind. And when there is a surgery on the mind, tears is equal to bleeding, basically. When a surgery happens, blood flows. Physical surgery happens, blood flows. When mind surgery happens, tears flow. And that catharsis, and the point where the tear flows, that is the most painful part. That is how. So we have to keep a check on at what moment this person shed a that I'm just trying to share with you so that you know even at a home level or friendship level or at church level, you can be sensitive about people's emotions and sentiments. Okay? Now come to the last part. Okay? Managing toxic emotions. How to process your emotions. Okay? And which emotions we are talking about? Toxic or what? We don't want to process positive emotions. We are talking about negative emotions. Let's first understand how people out there, okay, are using negative strategies. Means which is not recommended, or rather, coping strategy. Coping is to, sort it out. But sorting out can be negative. And negative coping strategies are random or at a lay level, okay? This slide is not recommended, but this happens. What happens? For emotional problems, people resort to, so before that, toxic culture. Let me explain to you what I mean by it. It's important to develop a culture for healing. Okay? And this is what the toxic culture, people who are following toxic culture for coping will follow this. Substance abuse. Okay? 80 to 90% substance abuse will be resorted for dealing with negative emotions. Okay? It could be alcohol, it could be drugs, it could be psychedelics, or whatever it is. I have come across people who come after 10 years. I said, how did you cope up for this 10 years? No, I was into alcohol or I was into drugs or something like that. Now what happens with alcohol and drugs is basically they definitely give a symptomatic relief. Symptomatic relief उस वक्त के लिए ठीक लगता है, but the root cause is not addressed. So when they come to their senses, again the problem occurs, and again there's a loop basically. So that's not a permanent solution. Okay. Next is hoarding stuffs. I have seen people hoarding stuffs. Now this is another. Hoarding stuffs means when you see people doing very much excessive stuff. Hoarding stuff is like, now again these are extremes. I'm not talking about normal distress level, the dysfunctionality and disorder level thing it is. Okay. It's like let's take, I'm talking about one person who was having separation anxiety issues. Separation anxiety, not the not means he used to be always afraid of losing people from his life. This, okay? When I visited his house, okay, when the door opened, what I saw in all the rooms were newspapers from 20 years back. It was hoarded. Okay? And I said, wait a minute. Why is this hoarding them? Hoarding is to accumulate things. One newspaper is enough every day, right? But so many newspapers, and his family saying, they go nice sab rakh diya and all of that, and they wanted to throw it out. I said, no, wait a minute. This shows that, these newspapers are not newspapers for him. These are people for him. I hope you understand that. He's associated, no, he wants to attach, wants to get attached on. So my point is, this is extreme condition, but what I'm trying to say here is, if people try to hoard things, it could be watches, it could be shoes, okay, it could be anything. If they can afford cars, then number of cars basically, high chances there is some emotional problem because of which excessive hoarding is happening. So, again, normalcy is different, but abnormalcy, I'm talking about abnormalcy. This is also seen that, ज़रूरत से ज़्यादा अगर कोई कर रहा है, then there is an imbalance there. There are high chances that person is overcompensating with hoarding. So that's one more thing. Okay? Again, these are extreme. This is an extreme, not normal thing. Being a workaholic, okay? And I tell you what, many people take pride, I'm a workaholic. But like I'm saying, alcoholic, workaholic. Why is that holic word in front? Moment the holic word comes, it means you're doing too much than what you're supposed to do. Excess. Again, the excess part comes, right? So when a person genuinely is overworking, high chances this person has some emotional problems for which this person is overcompensating. So if someone is being workaholic, high chances there is either childhood, teenage, or maybe there's a marital issue or something on the other side. So if somewhere there that emotions are not regulating positively, or she is wanting to excessively engage into work that is working for him. You know, I'm trying to give more work. So, emotion, binge eating, okay, binge eating or emotion eating. These days it's very much going on, right? Okay, for endorphin release, for dopamine release, okay, if there is no normal lifestyle or healthy lifestyle, high chances people might eat and create the dopamine and create the endorphin. That's where, and eating too much and not in parts. So binge eating is, and also emotional eating. Eating has to be done for the stomach and the glucose level, not for the tongues. Okay, so that's why it's called emotional eating, because to release those chemicals, dopamine and endorphin, okay, people tend to do something. It's like, you know, after a breakup, there was this lady who was saying that I'm eating too much of her. Basically, that guy, okay, who she was close to, he was the reason for her dopamine and endorphin release, right? But now she has to compensate those chemicals with something else, and the very natural attachment she feels is to food, basically. Again, what I'm trying to say here is, I'm not saying this from a judgmental point of view, this is just data being presented to you, basically. Okay? Impulsive shopping. Yeah, impulsive shopping, dopamine release, endorphin release, okay? And that's all. I mean, so sometimes, you know, you just want it, you just shop, one person just shops it, goes home and he realizes, or she realizes that I don't need this. Or rather, hoarding sometimes, you know. And these days, you know, the malls and all of that, they have understood consumer behavior. Did you notice Big Bazaar and all of the places? You could take one Harpic or one particular shower gel, but they have put 4 to 5 together. 4 to 5 bundle together. Yeah? And they have understood, chalo le lete hain. And then they show the discount also. If discount is there, your dopamine is going to release, no? Arey wow, paisa bach raha hai mera, you know? 50%. So there is a huge market, exactly. And you say, you know what? Money saved is money earned. So you feel like you have earned money by saving money there. Dopamine release. And also hoarding is happening. And who will fall prey to this? Maybe more prey to this is ones who actually are suffering from some emotional problems. They are much more vulnerable to hoard these things, basically. I hope you get the point. Now next time, I've had their strategies now, you know. People may say, why did you see this type, you know, anyway, but I'm going to create awareness. Impulsive shopping, yeah. Next is, unfortunately, homicides, suicides and genocides. Homicide, killing others, suicide, killing the self, genocide, killing multiple people at a time. If you have noticed, in the US schools, those are genocides, okay? Like, definitely the person who has done that definitely must be having an emotional problem which was not regulated, toxic problem which was not regulated, as a result of which all that badass, all that toxicity then came into a genocide situation, sort of, you know. And constant gaming, yeah, these days a lot of gaming happens. Sorry? See, I'm talking about the extremes, I'm saying. Yes. When a person goes out of balance, is doing excessive, then this whole thing is a problem. Then it goes to dysfunctionality and disorder level. If you are at a distress level, that doesn't matter. So everyone, that's the whole idea, you know. I mean, I'm giving you an assurance, don't worry. Yes. Yeah, oh my God, don't worry, okay? Yeah, constant gaming or checking social media. This creates, checking social media, they might have the likes, okay? What people are talking about me, okay? Or when you get a compliment, I'll hack this, okay? When you get a like, okay, dopamine release happens. When you get a compliment, serotonin release happens. Arey, you're looking great on in this dress, huh? Pride, no? You get that pride, you know, see, I'm looking good. That's fine, that's absolutely fine. But again and again, if a person is doing that, high chances, you know, elsewhere he is not or she is not getting that. That's why social media is the only platform, maybe is attention seeking and other things are happening. Again, all of this has to be done in proper balance. If you are doing it in proper balance, no problem. But if a person is craving for it, or is feeling very much disturbed if someone does not like this person, or is not complimented and that is creating a mood off, that's a problem. That is a dysfunctionality level, hence there are good. If someone likes, fine, doesn't like, move on with other life. If that's the case, it's fine. But then because of this, not going to school, not going to college, could be a problem, right? That's the dysfunctionality level basically. That's why I explained to you distress, dysfunctionality and disorder level. Okay, excessive sexual stimulation through pornography, masturbation or paraphilia. This is also seen. Excessive pornography, excessive, what we call, masturbation. Again, excessive. All of this at a, what we call, normalcy level is absolutely alright. But these are markers that the emotional health has gone in the south, in the negative manner. So paraphilias are basically abnormal sexual behaviors. That is also linked to toxic emotion experienced at some point of time. So, okay, these are the negative coping strategies. Let's now talk about a positive coping strategy. Okay, this is the second last slide. Positive coping strategy. This is recommended. Okay, and when I say that, culture development is important. Building a positive culture. When I say building a positive culture, routine, regularity and rhythm. On a when I say regular, that regularity you decide should it be on a daily basis, weekly basis, monthly basis, fortnightly, monthly. You have to decide what should be the regularity of it, what should be the routine of that regularity and what should be the rhythm. Okay? Now, timely expressing, okay, to an unconditional family friend or in a journal, okay, or a professional counselor. Don't build up. Whatever those toxic emotions are, it is important to timely express it to either a person who you trust in the family, who you know that this person is not going to go and tell 10 people about what is happening in my life. He or she is going to keep it to herself. Okay? Why am I saying timely? Because don't allow the build-up. Don't allow the build-up. Because what happens is, let's say, see, this particular table has so many things on it, right? That laptop, the projector. Is this cracking or is this crashing? No. But let's say if I put that pot out here, maybe the load is going to be more. Then I stand on it and I invite 4 more people like you to stand on. What is going to happen? It's going to crash. So the build-up happens, right? And at any given point of time, that table is going to have some threshold after which it's going to collapse. Similarly, our mind also can handle limited things or process limited things at a point of time. When you are experiencing something, express it, process it, it's free for new things, right? So that build-up should not happen. And whatever stories we hear about suicide, particularly suicide, it is impossible without build-up happening. It's not one-off thing. It's the last straw on the camel's back, whatever happened last. People see, Sushant Singh thing happened and that time, the counselors were full on busy because every youth is talking about, we can do it, to hum log to kya kar sakte hain? And we had to be 24/7, on call. And we used to tell them, means our community, counseling community, that even at 2 o'clock, even at 3 o'clock, if you feel something impulsive, call us. And I had kept, a ringtone, khas ringtone, SOS ringtones. If if that ringtone happens, I have to attend. It's like the ICU ringtones, I would say, Literally, if they call, you got to attend because they are in a vulnerable state. So point is, many people say COVID tha, iसीलिए COVID was the last straw on the camel's back. There could be relationship issues before that. There could be some childhood trauma before that. Many other blocks may have been for COVID to just be a reason for things to just crash. Yeah, so that is the reason I'm saying the bracket word is very important. What is the bracket word there? Don't build up. Okay? If we don't build it up, we will be able to manage. The human spirit is very, very resilient. We can bounce back. Okay? But if it builds up, okay, believe me, psychiatrists and psychologists also will be crashing with the we know everything, but that doesn't mean, we are God or we can manage everything. So if the build-up happens, the expert will also crash. So don't build up. Okay, next is healing on past emotional traumas. Like I said, identify if you have gone through some past emotional traumas. And if there is something that always bothers you, even now, definitely speak to a counselor and get them to closures if you want to live an optimal life. Okay? Positive. Building positive relationships and community life. Research proof fact. Okay? The more positive relationships you have, it could be 2 or 3 also. But you know that this person is what where I feel comfortable and I will be able to express myself positively. You definitely will be in a better frame of mind. You always I have someone to talk to, or I can the go-to person, the comforting person, someone. And also I will highly recommend the community life. Okay, community life again, if it is a positive community life. Sometimes going to some particular community and doing gossip and feeling bad about something, that's not what I will recommend. One has to evaluate. I always say this, that every company or every institution does an audit, right? Financial audit. Similarly, I highly recommend people to do relationships audit also. Every year, whoever has acted positively on you, whoever has bonded positively on you, they are your assets. And the ones who actually charge you negatively are, really, really not being positively, liability,
Right
you
off.
got to just, and gracefully come out. You don't have to, bitter it out and come out. So one has to do that relationship audit from time to time. Yeah, that's nice. Okay? Installing healthy and positive belief system. Okay, installing healthy and positive belief system is basically about it's like that's the reason okay, religion, community life, okay, or a particular following. If a person is actually having a particular belief system installed and it is a positive one, irrespective of whichever religion, whichever following, whatever it is, at the end of it, it should be positive. And if some people who are, I speak about atheists also, when they say that I don't believe in God, I said, no, I'm not a believer, they say. I said, okay, are you saying not believer in a religion? No, I'm not a believer. I said, do you believe in yourself? Yes, I believe in yourself. Then you're a believer. You believe in someone or something, right? Irrespective of whatever you are believing, whichever faith, whichever community, at the bottom line, the elemental thing is it should be positive. That should positively charge you. And if that belief system is positively charging you, maybe your neighbor's belief system is positively charging with some other follower. So be it. So far, both of you all are positively charged. 2 positives coming together will become more positive, right? Yeah. So always remember either some or the other belief system has to be installed in you. Okay. Scoop out of 10 more belief system, but because I tell you why. Why is it said? Belief, thoughts, and actions. What you believe, you will think in that direction. What you think, you will act in that direction. So, if you have a negative belief system, your thought will be negative, right? And then your actions will also be negative, right? That's the reason you got to do the audit of your belief system also from time to time. And it should be progressive enough. एक ज़माने का अगर कुछ लेके बैठे हैं, that worked for you then, but it may not work for you now. So adaptability matters. Okay. Makes sense? Yes. Pursue sports, exercise, and some art form to regulate and stabilize emotion. Catharsis happens. Okay. Or also, let's take some people are into knitting. When they knit and they make a particular sweater or something, they feel nice about themselves. They feel pride that हमने ये किया. Which chemical releases? Serotonin. Pride. No, I did that. Chan. Okay. And also dopamine if it is having like reward kind of thing. Yeah. It's an achievement. But if achievement factor is not there, but pride element is there, when you show it to anyone, let me tell you, simple सी बात. You do something and you're showing it to the world. That is the serotonin release. I hope it is. In terms of relationships also, okay. There's a guy-girl relationship. Normally, this is a marker. The girl comes to me, I'm in a relationship. So great. But you know what? I'm relationship has come to the serotonin level. Do you understand that? That pride, he's feeling the pride that she's my girlfriend. Yeah, but till that the point doesn't come, it's a red flag. I hope you understand that. It's a red flag, maybe it's just a fling or something like that, but not a long-term relationship. I hope you get the point sort of, because he's not feeling the pride of showing it to the world, right? I hope you get that. I'm just trying to help you interpret these emotions at a chemical level. Once you understand the chemical level, you will actually, manage your outside world and then create your inside world. Or at least understand the other person's inside and outside world. Okay? Yeah. Travel from time to time. Yes, travel is also a fact. When you travel, okay? See, I understand there could be limitations. Two things. One is one has to have enough physical and finance, physical health to travel, and finance also. I understand there are limitations, but research would fact when life is not in your control, when life doesn't, life goes out of control, then, and if you decide to travel is and plan the travel and go ahead, it's like seeking control by traveling. I hope you understand. Because you plan, you go to a destination, you book things, and it goes your way, right? I hope you understand that. So a very quick fix control seeking could be planning a travel and actually booking and going there and you mark, I will see these 3 things. So you are taking charge of your life, right? You are taking control of your life. So even though if it is a nearby place, go and travel. It's basically more than traveling to what it is, planning and taking control and taking charge of your life. And let me tell you, when you achieve a destination, when you reach your destination and you come back, which chemical is released? You have planned and you achieved the plan, right? I hope you can. Dopamine. You sorted out. And if you are going to a car, okay, one more thing I need to know. If you are turbulent, don't go to a noisy place. You know what I'm saying? Okay? But if you are bored and if you are feeling very isolated, then go to a noisy place. Do you understand what I'm saying? It's full to balance you. So when the sound is low, you increase it, right? When it's more, you decrease it. So one has to understand that. I hope you get it. Also choosing a restaurant also. If you are really tired in a week and really you need to loosen out, going to a pub, going to a disco and all of that is going to increase your cortisol. Not decrease. We've got to bring the cortisol down and increase the serotonin, the calm. So you will have to calculate it accordingly and charge yourself positively. I hope you're getting what I'm saying. Yeah? Travel from time to time. Okay. Regularly watch media content that will inspire and believe in the goodness of life, just like regular news. Okay? This point is, today there is a media boom. You agree? Media boom. Every time everyone is on the cell phone or tab or something like that. Great. If media is out there, then be very cognizant, be very conscious about what kind of media you are watching. And there is no harm in watching any kind of media, but in the rhythm, regularity and routine that I am telling you regarding culturing your mind, make sure that you see positive videos on a regular basis. I mean, I follow a routine, one TED Talk, you know what's TED Talk, right? Yeah. One TED Talk and one inspirational video has to be seen every day. Maybe while having breakfast or after I return. Similarly, you also put it in your rhythm, regularity and routine that the media that I'm going to watch has to positively charge me. So an example of that I will just try to show you. So what happens, when you compare yourself with others? Media comparison, okay? Let's take if you think you don't have enough in life. Watch media where people don't have equal to what even you have. So in that comparison, you feel grateful about your life. You feel, I am in much more better condition than this person, and I pray for this person to come at my condition and go better also. Not that, belittling, see, you are lesser, and I have more so. That's not what we want. Because in that process, we are trying to be, on the negative, jealousy and all of the other factors. Okay? I want you to see one video right now. That is an example
Leobald.
Привет, нас Дэви. И любовь к декоратам. Мне в мае будет 80 лет, и я счастливее многих из вас.
Leobald grew up in the part of the world where it gets really cold really fast, and the nearby lake freezes for 6 whole months every year. So as a little girl, when she had to go somewhere, she needed to skate.
Мои детей привезла старшая моя сестра, привезла ее в Петербург, они выпуска 45-го года. И вот они до сих пор у меня.
And the more she skated, the more she loved it. As she grew up, she moved away from the lake and away from all the ice, and found herself living the normal, boring city life. But no matter where she went, she always took her skates with her. Skates that reminded her of happier, simpler times.
Потому что с детства люблю конючку, я люблю катишься и катишься, а еще когда ветер дует сама, пальто откроешь, и можно изменить ногами, и катишься, и катишься, и катишься.
But real life isn't so simple. As the years passed, Leobald ended up losing her children and then her husband. She was alone and depressed, and she wanted to go back to a happier time. So, one day, she packed all her bags, left the city life behind, and moved back to her old home in the middle of icy nowhere.
Здесь очень может быть холодно, но я нахожу много тепла. И городская жизнь не для меня.
So, Leobald got herself a small farm, a few animals, and a whole bundle.
Иногда я просто делаю, иногда думаю, кого-то по делу. Собака моя, Симпа, 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 Симпа. Трясется тут этот самый зеркал стечет.
Here, just to get water, she has to dig into the frozen lake and collect water to feed her farm. And sometimes she has to skate for miles and miles to get to nearby towns and buy groceries.
Ближайшая деревня 4 километра. А если море выпущено, я передвигаюсь на коньках, ну, 30-40 минут.
So she unpacked her old skates, put them on again, and skated across the frozen river, just like she did as a little girl a long time ago. Slowly but surely, this lifestyle of simplicity started to make her truly happy.
Люди меня спрашивают, в чем секрет долголетия? Я отвечаю, катание на коньках.
We sometimes go through our whole lives searching for happiness. We think we'll find it in the biggest houses, the busiest cities, in the most expensive cars, or the latest gadgets. But here is a woman who's learned to find joy in the simpler things of life, like her farm, her animals, and her own pair of skates.
Yeah, so these are the videos. Yeah. By watching her live, does she feel a bit nice about it? Yeah, that's positive, yeah? Positive, yeah. And see, for her, ice
There's
skating.
one really big problem. There's one really big problem.
For her, her ice skates are her dopamine release. Okay, and also whatever, endorphin release and all of that. She has associated her ice skates to these chemicals. We have to do that association with whatever what we prefer basically. Just because she does ice skating, oh let me also start ice skating. No. Sorry? Yeah, exactly. Everyone has seen it's subjective. It is subjective. Point
See,
is.
this is clean water, and this represents how you're feeling.
Yeah. So, I'll explain that video later. That's the concluding video. But before that, see, that's the point is, everyone has to associate these You know what I'm saying? Everyone has to decide that. It is subjective. Stress masters, that's what, you know. Point is that. Okay, so yeah, the last one here. So you get it. That point was, I will highly recommend you to see 2 or 3 videos like this every day. So that you know what, you will really feel positively charged, and you know you will have positive role models to charge yourself. That's very important. Role models are very, very important, because you know what, that role model happens to say that you know what, okay, this is what I also can do it, but this is how I'll do it. So, okay. And the last one is supervised meditation. Yoga research for the fact that it works. Again, it should be supervised. Okay, YouTube पे देख के कुछ कर लेंगे नहीं possible. That doesn't work that way, because there is a protocol to it. So until unless you have understood the basic aspect of it. Okay. Having said this, these are the positive coping strategies. And the last particular thing that I want to say is, remember, consistency matters. Okay. What I said, that now whatever positive coping mechanisms we understood, once in a blue moon doing that is not going to work out. You will have to do it on a consistent basis, on a rhythm, routine and regularity. And the video that I want to show, it's the concluding video where, okay, this point is absolutely highlighted, that you know what, when we talk about positive thinking, when we talk about, you know what, I want to get positively charged, doing it once is not going to work out in the negative that is there. You will have to do it good enough. Okay, so if I explain it in that manner, minus 50, if I quantify it this way, minus 50 is negative 50.
Yes.
And plus 5, put it together. What is the answer? Minus 40, minus 45, still the minus is there? Okay. We'll have to increase the pluses, right? Chalo, we'll increase the pluses to 20. So you have charged yourself plus 20. Do the maths. Still there is minus 25. We'll increase the positive. Okay? 2 plus 35 plus 10. Not good enough, right? Because still the minuses are there. Now I make it plus 60. What happens? Plus 7. Plus 7. So what has happened here? When the pluses are more than the minuses, your average becomes positive thinking. I hope you understand that. If the minus is more than the pluses, you still are into the negative thinking pattern. This is perfectly gisted with this video, and that would be the end of the session. Okay, have a look at this. The title can be misleading. What is the title saying?
Why positive thinking?
Why positive thinking doesn't work? What does, I want to explain this title. You say, "Arey, abhi sab positive thinking mein chal raha." But what? Positive thinking doesn't work if you're doing it once a time. Positive thinking will work when you keep the consistency. Just like a cell phone, one time you charge it, is it going to stay for lifelong? No. So that is the reason charging yourself positively is not a one-time thing. It is a every time thing. I hope you understand.
See, this is clean water. And this represents how you picked, no flaws. See, this is clean water. And this represents how you're born. Perfect, no flaws, a clean slate. But then life happens. We're told how we fit in. We're told what we're supposed to do. What's not acceptable. What society wants. Some people get told that they're stupid. They get told that they're fat. They get told that they're not enough. We have some failed relationships. Compare ourselves with other people. We see the advertisements and realize then we're not as good as the Photoshop photos. And what happens? We become negative. And we start having negative self-talk. So not only is there negativity outside of you, but the negative self-talk is now negativity inside of you. Life happens. It's impossible to go through life without getting some scars. But then we hear that we should think positive. And that's like taking a little bit of clean water and pouring it in. It makes it a little bit more clear, but it doesn't make the negativity go away. And at this point is where most people give up. They say that positive thinking doesn't work. Well, if you go it this way, of course it doesn't work. But then there's some people that try a little bit of positive thinking. And they take more water, and they pour it in. And it becomes a little bit more clear, and a little bit more clear, but it's still dirty. But then you have to realize that this is what you have to do. Positive is life. You have to find the things to be grateful for, the things to be happy about. You have to be intentional about creating positive relationships and an environment in your life that's positive. You have to realize that the world is inherently negative, and you have to be intentional every day about filling yourself with positivity. And if we do, this is what our mind will become. It'll start to become a little bit more clear, and a little bit more clear, and a little bit more clear. Because see, positive thinking isn't something that you do sometimes. It's something that you have to do all the time.
So that's all. I hope this presentation was, excellent. With a lot of takeaway, right? Yes. I want to thank Nikita Patalkar, okay, to initiate this session. Okay. So Samulata, Regina, they were interacting with the entire competency A team and the community sort of. Best wishes to all what you're doing, and my prayers that physical and mental health be at the best and the optimal for you. Okay, thank you so much. Any question and answers? Yes. Now you can ask.
Sometimes the negativity comes from close family members and it is not possible to do away with them. Who does understand? This.
Take my
Sometimes the negativity comes from close family members and it is not possible to do away with them. But it tangles you up, it builds up. How to get over that?
Okay. So the thing is, when it comes from close family members, when we say this, there are two things here. Okay. The fact that a person has to compulsively live with that person. Somewhere there is a bond, okay, which a person has decided, no, I'm going to actually have to continue with this relationship, even though if it is toxic. When you said that, negative, right? Then that particular area, I'm speaking very practically here, okay? There is some dependency on that person. That is the reason that bond is still being continued. So when that happens, it's important to start developing one's individuality over there. Okay? That, for example, I always say this, that if we think life in concentric circle, one circle after the other, the innermost circle is the circle of the self, the individual self. Then the very next circle that comes out of it, if I go parents who raised us. If the person is married, then the husband or the marital circle comes. If the person has a child, then a relationship of the mother and the child comes in. If the person is working, then one more circle comes of work, relationship with work. So if, when you say close family members or particular close, one has to identify which circle is the toxic circle. And then accordingly, if it's important to develop oneself on the other circles, okay, so that an individuality develops on the other fronts. So then what happens? Plus 40, and if that particular thing is maybe minus 10, you do the maths, you still have plus 30, so where you can survive to that. If that particular relationship has to be there in life. But practically speaking, this can be done. If the disconnection is not the solution basically. If disconnection is not the solution, then one has to understand, always this is the case, that one has to see the positive and the negative. So one has to ask a question, this is more cognitive thing, okay? What is the reward that a person is getting by still being in that relationship? There has to be some reward somewhere. And then and one has to then focus on that which basically a person is getting from that relationship. That is the reason this person is there. And accordingly, one has to focus on the other areas to get it solved. Because see, if there is a majburi, if there is a kind of a helplessness, then definitely there has to be some reward behind that helplessness. If कुछ मिल रहा है उस relationship में रह के, that is why that relation is still there somewhere. So one has to focus on that practically. Okay, what is the convenience that is there in that relationship, and not depend upon that person for self-worth and self-esteem. For self-worth and self-esteem, other areas have to be developed where serotonin will be flowing. Otherwise, problem will happen. That's how it is. You get the point.
I enjoyed your talk. What I want to know is that you're speaking about what about women coming to you from there? That maybe how many men come to you from there? More of men. Same percentage of women or is men less or?
You talk about 25 above, there is no gender problem. But for late 40s and 50s, more women come. Men are coming, no doubt coming, if they are convinced that the counselor has that much of potential to counsel and so on. Because there is some ego factor somewhere associated. So once I come to know that this person has an ego factor, that has to be brought down in a natural manner.
So you also spoke about the recent shooting. There was absolutely no mention of a father in that in the synopsis that article that everyone was quoting. Do you feel absence of fathers in the life of children will create a problem?
The thing is, it depends upon which area the person is. Like, urban, tier 3 tier, as well as, US,
with me in all the crazy stuff I did. So I took the blame and I said, go ahead and run that marathon. And she ran and she got an award also for that. So I was happy that I was able to do that. But what I want to mention about my mother is, my mom feels, she had a very happy marriage with my dad. My dad was fantastic. But she's always talking about the women in the families who are divorced and very happy and financially well off. And she always say, you know, that woman she divorced and you know, her husband died and all that. She said, that's what said, mommy, daddy is sweet. Ah, daddy very sweet. And you know that one. So do you also feel that there's some kind of a thing going that divorced women are happier off or because I have a lot of married women coming in, you know, calling and saying, you know, this happened and I'm unhappy. And so what is this thing about being divorced and married?
It's all
Why are problems less in divorce and
It all depends upon what is the objective of everyone's life. And if the pattern, if see, it's all about, it goes beyond psychology level, it goes to sociology level. Okay? If the pattern, if let's say, let me explain this to you in if 100 women, okay, have a particular type of ambition, then there are high chances, you know, the pattern may be same. And earlier what used to happen is the institution of marriage, I'm not speaking psychology, I'm speaking sociology, okay? The institution of marriage, the objective of institution of marriage was different. And today the institution of marriage, the objective of institution of marriage is different. So what is happening is, the earlier institution, okay, but today's objectives, this is not going hand in hand somewhere. And that is the reason, if the ambitions are, you know, going beyond the institution's requirement, then people are choosing to, you know, divorce basically because they want to pursue that particular lifestyle that they want to. And they want them that the traditional institution of marriage will not work is basically. So today we have living relationships, today we have open relationships. Probably that may work given today's ambitions. So the problem here is earlier code, but new lifestyle sort of like that and thinking basically. There's an incompatibility in the sociology of the world. That's what.
Thank you. We should stop here.
we're going to go back to more than
Okay. Yes, yes. I call upon our President, Sharon Davis ma'am, to propose vote of thanks.
Thank you very much, Shweta, for this very beautiful talk you've given us. So many excellent inputs, which we have learned so much. I would just like to talk about 5 things. One is you mentioned very well about the physical and the mental, connecting it with gyms, hospitals, like, you know, new kind of perspective you could see. Another thing about emotions, like we all experience emotions, but how you touched on each of them and how there's no good and bad emotions. Yeah, so that was very good. Another thing was about the 3 R's. We always select 3 R's, we are always aware of is, you know, reduce, recycle, which we keep hearing all the time. So this was a different perspective about the 3 R's, which you spoke about rhythm, then you spoke about
Regularity.
regularity and routine. So the 3 R's. So I think this is something very different for us and we can share with others, different from the normal 3 R's that we keep hearing. And I also want to say that these 3 R's will renew us, like how we renew the environment. So this will be like renewing us in every aspect of our life. So that was very nice. And you even gave us one thing which we all need to do every day. And I think we should all promise this to ourselves, that we will see one video, one positive video and one TED talk every day. I think this much time we can take out for ourselves, because I know as women, mothers, wives and whatever careers, we don't do this. So whether we are traveling in the bus or somewhere or the other, I think we can do this.
So thank you for that, and we all promised that we will do it right. So let's just say we promise we will do this every day. One TED talk and one inspirational video. Okay, and I think after 1 month we have to tell Shraddha that we have done this or not, because that accountability, we need somebody, we can just say yes, we all did it. So many of us, how many of us are here? So all of us, we have to count. 30. So 30, every day 30 of us watching. So that's just what I want to say. Thank you very much. It was a lot of learning. I've taken down my notes, and I'm sure many others also have. So thank you.
Thank you so much.
Yeah. And thank you to the Parsi team and Nikita for introducing Shraddha to us, and all our IWCA staff who have put this thing together. Raina is the chairperson of Parsi and the Parsi committee, and all our members, all of you all came here today, so that made everything very beautiful. And the Shraddha also could share so many things with us. And we've been having, I was talking to Shraddha before this meeting, we've been having everything online. And she spoke so much about, how we connect offline. And we are just trying to do that, so that is, hopefully we'll be able to do more of it. And I also want to thank you, you said about doctor and psychiatrist. So I want to thank you for the doors that you've given us. Dopamine, serotonin, oxytocin, and endorphins. I just wanted to share one small thing. My daughter, when she was born, my second daughter, she wasn't breathing. And she was very critical after they cut the umbilical cord. So the doctor said that, we don't know whether she will survive, and there will be 90% brain damage. And then they had to transfer her to another hospital because the neonatal case was not getting proper care. So they transferred her to another hospital. And there was no proper ambulance. So the doctor took her in his car. And when he was traveling, my husband told me this, and I still remember this. Today she's 22, and she's studied well and everything. Okay, she's working also. But he had said 90% brain damage, and he mentioned this dopamine drip. We need to give her the dopamine drip. And once before I read about this, and now I understand, that word dopamine drip, I still remember it. And as you said, the rewarding chemical, so it helps her to get there. So, yeah, thank you very much.
As a token of gratitude to Shraddha, on behalf of Parsi and all of us gathered here, we'd like to present a small
बीच में आपको खड़ी हो गई थी